Good morning. Want to score high in PSM? Don't miss these must-know facts, which we will discuss today. So important latest health and disability indicator you should know for every MBBS, MD, FMGE exam, and even NEET PG aspirant. So DALY is what? DALY is disability adjusted life year. This indicates the burden of disease, and this represent the year which are lost. We have lost to life due to disease, or year which are lived with the disability. So YLL, year lost to life, and YLD, year lost with disability, we will add, and that represent the burden of the disease. So DALY is one indicator. HALE is opposite of that. HALE is health adjusted life expectancy, which represent the number of years which are spent in good health, that is free from any disease or disability. So whatever uh, we have lived to best of our health, that will be HALE, and the year of life lost due to premature death or due to disability, that is DALY. So it's a good indicator. HALE is a good indicator for health status, health expectancy. And QALY is quality adjusted life year, which is number of quality life years gained with an intervention. For example, if we we intervene for a breast cancer, we do surgery or radiotherapy. So how many lives quality of life years which have been gained? So it's an indicator of efficiency or effectivity of the intervention. So these type of tables are ready reckoners and you can make them. Now there are certain health and development indicator. We have a few of them, four which are highlighted and one below. So PQLI is the first one. So PQLI is a physical quality of life index. What are its sub indicator? So you can remember its life expectancy at 1 year. It takes infant into account, life expectancy at 1 year, literacy rate, and the infant mortality rate. So you can remember infant is 1 year, so IMR and life expectancy at 1 year, and literacy rate is another component, and it's a very old indicator. So now we have a HDI. HDI is a human development index. So what it encompasses? It encompasses the life expectancy at birth, not 1 year, at birth, the mean schooling year, the expected schooling year, and the gross national income. So PQLI takes account literacy, HDI, education, and national income. Now global hunger index is a new indicator which consists of under 5 mortality rate, undernutrition, wasting, stunting, and inadequate food supply. So it encompasses the malnutrition indicators and the food supply. So it basically targets the children. Then MPI, multi-development poverty index, multi-dimensional poverty index. So it has a very huge component. It has many components like health, education, and other components. So health include nutrition and child mortality. Education include years of schooling, school attendance, and standard of living. It include cooking, fuel, sanitation, water, electricity, housing, etc. So you can remember it encompasses health, which include nutrition and child mortality. Again, education. So education is there in all the component. In PQLI, HDI, MPI all have a education except GHI. So education is also there. Nutrition, child mortality is there, and certain standard of living. So MPI encompasses standard of living also, the environmental factor, social environmental factor also. So housing condition like cooking, sanitation, water, electricity, housing is that it takes into account. So coming to the current value, India HDI is 0.64, rank 134, GHI 27.3, serious hunger index, and MPI 0.069, again India rank 126 out of 143 in MPI. Now coming to the next indicator, which is HPI, Human Poverty Index. It encompasses three: longevity, education, standard of living. So HPI is a negative indicator. So how many people are, there is a probability that they will not survive more than 40 years. Probability of dying less than 40 years is a one component. Illiteracy rate is a second component. So all negative parameter will be there, and percentage not getting safe water will be standard of living. HPI2 is another defined component in which we take probability of living less than 60 years, illiteracy rate, and percentage of BPL family. So it encompasses the BPL family. Another important topic, that is the investigation of outbreak. So mnemonic, you should remember VC and Dean are doing formula testing evaluation in Rajasthan Research Lab. So V is the first step. So this is very important and you should know the sequence of step also. So mnemonic is important. So VC में V है verification of diagnosis, C is confirmation of epidemic, D is defining the population at risk, R is rapid search of cases, D is doing data analysis, F is formulation of hypothesis, T is testing of hypothesis, E is evaluation of ecological risk factor, IN is investigation of population at risk, and Rajasthan is report making. So this mnemonic you can remember to answer well. So this is the last topic which we will discuss today. So screening test. So we should know how to make a 2 by 2 table. So disease component will be in the upper part, and we have in the lower part is a left side will be the test, and in the rows it will be disease positive, disease negative, and test positive and test negative as shown in the slide. So you will make true positive, false negative, true negative. So if test positive, disease positive is there, it will be true positive, test positive, disease negative, false positive, test negative, disease positive, false negative, and test negative, D negative is true negative. So remember the key rule that we go horizontally to calculate PPV and PV, and we go down or up to calculate sensitivity and specificity. So sensitivity will be go down, TP upon TP plus FN. Specificity go up, TN upon TN plus FP. PPV go horizontally, TP upon TP plus FP, and NPV is TN upon TN plus FN. And you should remember likelihood ratio is sensitivity upon 1 minus specificity. And series, if two tests are there, the specificity will increase and the sensitivity will decrease, and vice versa if the two tests are given conducted parallelly. And you should remember the PPV is dependent upon prevalence. Stay tuned for such ready reckoners in future. Best of luck. Thank you.